As a government, we remain committed to taking real steps, concrete steps, to respond to the calls for justice and to work collaboratively with families, survivors, community-led organizations, and Indigenous leadership to end the cycle of violence and to offer our support to the victims and to loved ones as well. Let's talk about getting our lives back a bit. We need Manitobans to continue to do two things: get a vaccine as soon as possible and follow the public health orders. The quicker we do these two things, the faster we beat COVID. And the sooner we can safely reopen our economy and start to get back to doing the things that we miss and that we love. I want to commend the hundreds, thousands of Manitobans who have participated in our vaccination efforts thus far. Our internal numbers show us leading the way on the percentage of people eligible to get vaccinated, being vaccinated in Canada, and we're continuing to push that effort mightily, and I say thanks to our vaccine team for their great work, and thanks to Manitobans for your willingness to roll up your sleeve for the first available vaccine. Thanks for doing your part to protect yourself. Thanks for doing your part to protect your fellow Manitobans as well. To date, roughly 880,000 vaccines have been administered in Manitoba. Isn't that an unbelievable thing? And that represents about 2/3 of eligible Manitobans who've received at least one dose of vaccine. What's also real is that we can't stop there. These variants are fast-acting, dangerous, and we have to be aiming higher. It's a significant accomplishment, but it's not over. There's a monumental challenge to get more life-saving vaccines into the arms of as many Manitobans as quickly and safely as possible. And that work is what I'm here to talk to you about today. Until very recently, our number one limiting factor in protecting Manitobans was vaccine supply. But now, as we approach nearly 70% of eligible Manitobans vaccinated, our challenge is to reach the other 30% of eligible Manitobans who, for various reasons, have chosen not to get vaccinated to this point. The epidemiologists call this vaccine hesitancy, and there are various reasons for it. It could include just your physical location, where you are. It might be a mobility issue. It might be a language barrier. It might be cultural or religious concerns. But we have to get past the 70% vaccination mark. We have to get to 75, then to 80, then to 85, and higher. And that work is going to happen, and it's going to happen 10 or 50 or 100 vaccines at a time. But those numbers are achievable and necessary so we can get our freedoms back. The freedoms that perhaps we took for granted until recently. The freedoms that many people didn't enjoy before they came to this country. The freedoms that many people had taken away from them, like our Indigenous Canadians in the earlier days of our Confederation. Those freedoms are treasured things, and we want them back. To get them back, we need to get vaccinated. These numbers are achievable, but they're going to require hard work, they're going to require focused effort, and I believe they're going to require community effort too. We know from our research and from the clinical leaders in our province that there are thousands of Manitobans who are open to getting a vaccine but have yet to get one. And they need support in that decision. And they need support from you. They need support from people they know. They need support from people they trust. Pretty clearly, Dr. Roussin and I can talk about vaccines all we want, but we don't know everybody. But people in our communities know their friends, and they're influential. And so today I want to share with you the next phase of Manitoba's Protect MB vaccine effort to ensure broad uptake across the province, because that's crucial for the reopening of our economy and our communities. This new phase of vaccination promotion and delivery is going to have a focus. First of all, it's going to be Protect MB community outreach and incentive grants. We're going to offer up to $20,000 in financial support per organization, group, or business to work with them and in low uptake communities. Funding for programming could include many different things. It could include outreach staffing, contacting, supporting clients to get vaccinated, communications materials. It could even include community-level incentives like meals. Interested applicants are encouraged to register now for an information session at protectmb.ca. Our government is ready to support and encourage community-based Team Manitoba efforts to protect all Manitobans through vaccination. Throughout this pandemic, we've reached out to you to ask for advice, to ask for help, to ask for volunteers at times, to ask for your support in doing the right things. And doing the right thing now is helping your friends and neighbours by encouraging them to get a vaccine. Secondly, Manitobans, as I said earlier, have had many freedoms restricted during this pandemic, and they're missing them. We all are. Getting vaccinated will allow us to get our freedoms back, which is why we're unveiling the next phase of Protect MB's advertising campaign. It's going to focus on the activities and the spaces that Manitobans have missed most of all, and that vaccination will allow us to return to. We lost these things, now we can get them back. Manitobans have told us that getting back to the things they love is one of the biggest incentives to getting vaccinated, and we're going to reinforce that through this advertising campaign. At every step of the way throughout this pandemic, we've endeavored to reach out directly to you to provide information, to provide education, sometimes to demonstrate the severity of not doing the right thing, and sometimes to demonstrate the rewards of doing the right thing. These communication efforts will be bolstered by a $2 million traditional and digital advertising campaign, media bulletins, news releases, press conferences, telephone town halls, stakeholder and industry roundtable discussions, multiple public surveys on Engage MB. Now, some of you may be thinking, well, I already got my vaccine and I got my second one booked, so why are they bothering to incentivize me? We're not. We're happy that you made that choice, but many others need to too. And so our focus and my announcement today centers on those folks, the ones that you need to talk to do the things you've already done. You have your reasons for doing them. Share those reasons with others in your circle of influence. All of us have those circles. And someone in your circle needs your word of support right now because they trust you and they want to hear from you about the importance of doing this. Information's power, and we're doing everything we can to ensure that Manitobans have the information and the support they need to make the right decisions to protect themselves, protect their loved ones, protect their community. But I'm asking for Manitobans' help now. Thirdly, we have expanded and expanded and expanded our vaccine access. I won't get into the lists of pop-up clinics and super sites right now, just to say that we have them and they're out there. And there are a couple of hundred different options for you, so you'll be able to choose among them to get the most convenient one for you and the one that you feel is the safest. We want to make sure that that access makes it easy, that makes it possible, and that makes it encouraging for you to get your vaccine. Manitoba's Vaccine Task Force shared details about some of this with you yesterday. We're looking to get more vaccines all the time to more communities through pop-ups, community and employer clinics, pharmacies, health clinics, and so on. Finally, I want to say thank you and mention our Protect MB Campaign Advisory Committee. It's co-chaired by epidemiologist Cynthia Carr, by Dana Spiring, my friend who is the president and CEO of the Economic Development Winnipeg organization. And it includes a diverse group of leaders and influencers representative of business, community, nonprofits that's going to help to guide and has given us input already on our vaccine initiatives that's going to help shape our reopening plans. More on that next week. And it's going to help promote vaccination in their networks, their communities. Collectively, this is a very impressive and important advisory group for us in guiding us. We're at a critical point in the third wave. There's every reason for optimism. We have more vaccines going into arms. We have people abiding by the public health orders. Continue to do both those two things. Those are the two things that you need to do every day. Abide by the public health orders so we can get our freedoms back. Short-term pain, hopefully not too long-term for gain. And get vaccinated. As a government, we're doing everything we can to bolster vaccine availability, accessibility, to equip Manitobans with the info they need. This is a decision that you need to make as an individual. We accept and understand that. This is your body, and it's your right to make that decision. But it's our obligation to encourage you to make the one that's best for you, and best, I think, for Manitoba and for Canada as well. We all want to get back to some sense of normal. And the path forward to do that is to get Manitobans vaccinated as soon as possible. It's time for all of us to get on Team Manitoba. Time for all of us to work together to get this vaccine campaign finished. And it won't be finished until Manitobans are vaccinated in sufficient numbers so we can protect each other, we can protect our healthcare system, and we can safely reopen our economy and our communities. Manitoba is a beautiful province for community-mindedness. This is the chance to use that community-mindedness, that wonderful quality that Manitobans have demonstrated throughout our history as a province of supporting worthy causes, to support this one. The most worthy cause perhaps any of us will have the chance to support in our lives is in front of us right now. So I encourage Manitobans to do that. We need your support. We need Manitobans to roll up their sleeves and get vaccinated. Thank you. Look forward to your questions.
Thank you, Mr. Premier. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this morning from the Winnipeg Free Press, Carol.
Good morning, Premier. What would we have done if other provinces had not been in a position to take ICU patients from Manitoba?
Well, I'm really happy and I'm thankful that other provinces were able to support us in our time of need, as we've always supported others in their time of need, Carol. And I say a special thank you to Premiers Kenney, Moe, and Ford for allowing us to have that additional ICU capacity. We doubled the ICU capacity as a government from what it was in the pandemic, and thank goodness we were able to do that. We increased it by 40% from the time we came to government till the pre-COVID, till COVID struck. Thank goodness this pandemic didn't happen in 2016 before we'd had a chance to start cleaning up the ICU emergency room mess that was there. But we did, and so we were not ready for this onslaught, but we were ready for a significantly larger onslaught than has ever been experienced in Manitoba's history.
So was there any plan? What was the contingency plan if other provinces had been in the same position as us and hadn't been able to take any ICU patients in Manitoba, and next week when ICU admissions are supposed to peak, what if other provinces can't accept any of our patients? What if something happens and they can't? I mean, what is the plan if this happens again?
Well, actually, Carol, because the capacity is there, because we were later coming into the third wave, other provinces had passed their peak. There was the capacity in other jurisdictions. So I don't know that it's that helpful to talk about the worst case scenario that could have happened if every province in Canada had the peak at exactly the same time. That wouldn't really have been a good thing. I think we all know that. But we've adapted as a government, as every other government has. We've been really pleased to ask for and get support from our friends in the Canadian Confederation. And as I say, Manitobans have been giving and helpful to everybody else in the Canadian family and elsewhere throughout our history. So I don't feel badly asking for help, and I'm sure thankful that we're able to get it.
From Global News, Brittany.
Good morning, Mr. Premier. In the technical briefing this morning, we were told that some research found that the higher the monetary value of incentives, the more effective they were. So why just go towards these smaller community incentives as opposed to one larger incentive that we've seen, say, in the States where there was $1 million lottery? And is there going to be any sort of limit on these community incentives and what they're allowed to offer?
Couple of points, Brittany. There'll be more to say on incentivization next week. and we'll be announcing a reopening strategy as well. But here we're talking about grassroots organizations and grassroots organizations that have networks, right? And many of these, in fact, most are volunteer-based. They're not in it for the money. They're in it for social betterment. They're community clubs. They're sports organizations. They're cultural groups. And so a little bit of cost recovery, encouraging behavior that is pretty much habitual for a lot of these organizations who are giving back to the community all the time, can go a long way to reaching out to the networks that they're very influential in. It's about trust, I think, and the local groups you have great trust for them because they're your friends and your neighbors. That's how we think we can make this work better.
Thank you. And you did touch on a reopening plan being announced next week. What can people expect? Is it going to look similar to what we've seen in other provinces? And will there be anything in there specifically for people who are fully vaccinated?
Yeah, I'm looking forward to presenting that. I think it would have been in Congress to have done it last week in the midst of the worst, well, what we hope would be the worst time for case numbers and so on in the province. But I do think that it is important to put that hope in the window. And I do think it's really important to understand that the limiting factor for all of us now is really vaccine levels, as long as we have, in the old days, 8 months ago, before these variants showed up, we heard people say, well, once you get to 2/3, it'll be fine. That's herd immunity. And I said the other day, and I maintain that's a myth. That isn't the way these variants aren't going to give us that kind of protection. If we have 400,000 Manitobans unprotected, we're looking at a fourth wave. And I think that's well chronicled. The Globe and Mail did an analysis last Saturday in their newspaper of various scenarios talking about what happens if you get 75% versus 80 versus 85. What happens? And in every one of those models that they projected, 75% meant there was going to be a significant fourth wave. We don't want that yo-yo. Nobody in our business community wants that. Nobody in this province wants to get their freedoms back and then have them taken away from them again in the fall. That's why we're pushing real hard for more vaccines. We think that's the right thing to do. And I really sincerely believe our community groups are going to be a big part of helping us to get that number up.
From the Brandon Sun, Kimberly.
Good morning, Mr. Premier. My question to you today is, so what do you say to the Manitobans who have gotten their vaccine to protect themselves and their neighbors who aren't in a low uptake community, who may not have access to the grant?
Well, I'd say understand that we're going to have to focus together on getting as many people vaccinated as possible. And thank you for doing the right thing. And this isn't about getting a grant. I think most community organizations in communities that are safe and have no cases would understand right away that there isn't a lot of outreach for them to do. So we're going to have to focus on where we can get better outcomes and better results. And that's for sure what our criteria that our government employees that are going to be evaluating these applications are going to have to take a look at. What can be most effective at pushing that vaccine number up?
Thank you for that. My second question is there anything coming down the pipe for those people who have gotten their vaccine and who did everything that they've been told to do by the government?
Yeah, well, there certainly is. It's called security and a better healthy life. The more people that get vaccinated, the better chance that they're not going to get COVID. That's a wonderful reward right there. As far as additional rewards for people, I would expect in the reopening strategy there's going to be some reference to the benefits that would accrue to people who've got that second vaccine for sure.
From CJOB, Clay.
Morning, Mr. Premier. How are we going to convince those Manitobans that are just adamant? You can throw all kinds of incentives at them, grants, money, free beer, whatever you can think of, but they won't get the shot. What's your message to them?
Well, my message is the same as it's always been to those folks, Clay, you've referred to, represent by every poll, and this is not inconsistent nationally. Less than 10% of people who are absolutely anti-vax for whatever reason. The target has to be those folks who are persuadable. And that would be another 20% perhaps who have for some reason said that, I'd like to delay this a little bit. I'm not quite confident yet in the vaccines, or I'm just reluctant to do it for whatever reason. That's the target audience, I guess, to put it in that parlance. And, those are the folks that we think our community groups can be a very effective allies in reaching out to and encouraging to do this now. Because clearly, the longer it takes to get that number higher, the more freedoms will, the slower the recovery to get our freedoms back in every respect. So those two things are related to one another. We think having allies in the community explain that have the trust of their friends and neighbors, is a real useful aspect of how we're going to get that number higher.
I was driving along Main Street yesterday afternoon, Mr. Premier. I noticed a long line of people at a food bank, and it just got me thinking, what steps are being taken to make sure the homeless population is vaccinated?
Yeah, the VAX team has taken some initiatives already, as you know. In a general sense, I'll talk about those sort of hot zones that they referenced back a few weeks ago, really reaching out to the vulnerable communities, including the homeless in the city. This is important. It's a risky enough lifestyle living on the street without adding COVID to it. And we want to help those folks get vaccinated as fast as we possibly can.
From the Winnipeg Sun, James.
Good morning, sir. There were not that many people at the last anti-vax rally at the Forks, perhaps 150. Do you think those experiencing vaccine hesitancy or even refusal are slowly being won over? And if so, why might that be?
Well, James, the numbers are pretty clear. I've seen polling from comparing last December to, if I remember correctly on the poll, it was to the middle of May, showing that the percentage of vaccine hesitancy had dropped significantly in virtually every demographic. So I think part of that was the reality of seeing COVID, the reality of understanding through the media and through personal experience perhaps, that COVID really is real and that it impacts on people in a real way. The more people see that, the more people understand that, the better, because it is about the dangers of COVID after all. And COVID kills people, and COVID makes people really sick. And getting a vaccine really reduces your chances of being sick, and of course helps you to protect others as well. So that message is getting out there, not to everyone, ever, but it's getting out to more and more people all the time, and that's good.
Is it possible that vaccines could possibly become mandatory in a worst-case scenario?
It isn't. Not under my leadership, it won't be. This is your body and your decision. There are some things that are absolute to me, and I don't want to live in a country where people are told what to do with their body, and that is, I hope, the prevailing belief of most Canadians. That being said, we have an obligation as people to help others do the right thing, always, whether it's abide by the laws of our province or country or abide by our health orders. We have an obligation. I've seen thousands of Manitobans participate in helping that happen by calling our tip line, by helping enforcement officials, by being supportive of health officials, by offering hope to people who are in vulnerable situations. I've seen it again and again and again. But I respect individual rights and freedoms, and we have to be, I think that's one thing we have to remain absolute in.
Thank you.
From CBC Manitoba, Bart.
Mr. Premier, on that note, what is your personal philosophy on the notion of preventing unvaccinated people from entering certain kinds of post-pandemic amenities, such as movie theaters, concert halls, professional sports venues, large places where people gather in large numbers? There is already, we've seen in Ontario, there's been one university that says unvaccinated students cannot go and live in residence. And it's not based at the broad school population, but You just ruled out making vaccines mandatory. I understand that. What is your position on the idea of restricting some privileges for unvaccinated people?
Well, we already have, Bartley, you know this better than anyone. I mean, we have requirements to do for a number of activities and pursuits right now that you have to satisfy before you can do them. I think as an interim measure, being able to prove that you've been double vaccinated, for example, so that, a larger group can get together of unvaccinated people. For example, in a seniors' home, we have the vast majority, thank goodness, of our seniors protected now with a second vax. Being able to have them have a chance to get together socially, as opposed to another group where nobody's been vaccinated or a smaller number has been vaccinated, it makes, I think, common sense to most people. But none of us want to see divisions within our society among our friends and neighbors based on this issue, but we have to have public safety as the first priority. And the public safety of our province depends upon higher vaccine numbers, and that's what this announcement today and other announcements that will follow are all about. They're about persuading people. In our society, we go less to dictating and more to persuading, and that's what we've focused on throughout this pandemic largely, and we'll continue to.
So on that note, if I'm understanding what you're suggesting there correctly, are you saying that in the short term, at least, the province will restrict some movements of unvaccinated people to places such as personal care homes?
I think what I'm probably inadequately trying to explain, Bartley, is that I think we're in a dynamic time where I would rather see us bestow benefits on people who pursue vaccines as opposed to suggesting that everyone else is limited. In other words, that there's a bonus for getting your vaccine. As I said before, the first bonus, the most important one, is that you're protecting your health and well-being. But it may be, as an interim measure to reopen, that we give extra advantage, like we did last night at a Jets game, to people who can prove they've been vaccinated and are willing to be safe in small numbers to be able to get together. To not give these benefits is to say that all of us have to be in lockdown until everyone is vaccinated, and I don't think that's a realistic model for us to follow, and I don't think it's one most Manitobans would want us to follow.
Thank you.
From the Canadian Press, Steve.
Oh, hi, Premier. I noticed that the money for these incentives is going out through community groups. And I'm wondering what feedback you got from the survey, the public engagement, but also the independent survey that convinced you not to offer sort of direct incentives from government, but rather have it go through community-level groups.
This isn't the final announcement, Steve, so I won't rule out that there'll be some individual incentivization. I think that ultimately there's lots of people in our province that aren't involved directly in a community group, a sports group, a church group, a cultural group. They're not. So we're not going to reach them this way. So we're going to look to reach them in other ways. But I was just going to give a couple of examples of where I think this might work. We've got lots of sports organizations in the province. Sadly, a lot of them, and I come from a sports background, and I'm teased about it by some of you in the media, but I like to think that our sports organizations have real good outreach and a real good impact on our young people in particular. One thing they could get involved in might be to send information about vaccination out in a league newsletter, or they might be able to contact all the league members with booking information. They might be able to partner with the task force and deliver a pop-up clinic at a local rink or community club. These are the kinds of things that we can get done together that are better done at the local level, better done by local community people, and I think they're going to be more influential than I'm going to be because I'm not a member of every community club, every church group, and every activist organization, community or cultural organization in the province, though I'm a supporter of them. I'm not the guy to do that. I think our community grassroots organizations are a real good, intelligent way to reach out to their members where they have influence and help encourage them to do the right thing and get vaccinated.
And back to the questions about the intensive care units, I think we're still expecting to see a peak that is not here yet, but it will be here in the coming days given the lag from the caseload numbers filtering through the hospital system. Have you been given any indication as to whether we will exceed the capacity of Ontario, Saskatchewan, and Alberta to accept our COVID-positive intensive care patients?
Absolutely none. There's no reason for Manitobans to fear in that respect whatsoever. We just got a commitment from Premier Kenney yesterday for a significant number of additional beds should they be needed. We would hope they would not, but that commitment shows you how the family of our country should work. And so, you know, it's all of us hope that we're at a plateau and we can begin to see a decline in number. But as you quite rightly point out, hospitalizations leading to ICU needs will lag that. And so I am so glad that this didn't hit us in the first year of our mandate in 16 when we had, from the Peachy report, which you can review, members of the media would be familiar with the Peachy report, Manitobans may not. But the Peachy report outlined the mess we were in at that time with unstaffed, non-staffed beds being counted as emergency and ICU capacity when they weren't available a lot of the time. We've upgraded our staff. We did this in the first 4 years before COVID to significantly, by 40%, increase the staffing, increase the equipment availability, and supersize or strengthen up our ER and OR capacity. And it still isn't enough. But the fact that we have increased by 40% before COVID, and then doubled that in the early days of COVID with the strategic work that we've done together with our nurses, with our doctors, with our advisors, medical leads, it's really an incredible accomplishment, and it still isn't enough. So the support of other provinces has been essential to help Manitoba, and I say, Manitobans, you deserve the payback because we've helped a lot of other provinces too in our history, and we'll continue to do that. In this case, we need their help though, and I thank them for it.
From CTV Winnipeg, Michelle.
Hello, Premier. I'm wondering if, since the focus here is education and community-level conversations, and it really doesn't have to do anything with supply of vaccine, why didn't we start this kind of outreach on the community level sooner in Manitoba? Why are we doing it now and not earlier? We could have been doing this concurrently with the vaccine rollout.
Yeah, no, that's a great point, Michelle. Up until now, I would say we've been reactive to an existing demand, right? So there's been no shortage of Manitobans wanting to get vaccinated. I think we're going to be moving in the next while here possibly fairly soon to a situation where we need to get that next group, the next 10, 15, 20% persuaded. And so the persuasion initiative that's underway, the advertising campaign, the community initiatives that are going to get underway are going to assist us to start to fill that gap. Right now there isn't a gap, but there's potentially going to be one. There has been one. When I talked to Doug Burgum, for example, governor of North Dakota, he said they went from lineups within a fairly short period of time to having to persuade people to come in. And that's been mirrored in a lot of other United States, and we think in conversation with some of the other premiers that this is what they're looking at over the next few weeks as well. So if we can I was going to mention another possibility here. I think this is an example of something else that could work. We've got we're the home of hope for people from all over the world. And we've got, because of our provincial nominee program in large part, we brought people, immigrants into not just Winnipeg, but Manitoba in significant numbers over the last number of years. And there's sometimes linguistic and cultural challenges there. The best way to get through those challenges and address them, I think, is to have the alliance of support from community groups. So we could, for example, have a community organization in downtown Winnipeg offering vaccine information in multiple languages and doing outreach to appropriate communities where that would be an additional way to get our messaging out, because English is a second language to many Manitobans. Equipping outreach volunteers and staff to promote vaccination, partnering with the task force on a clinic that's in that immediate area. So folks who don't have access to a vehicle, for example, or who are more comfortable going into a center that's close to where they live will be encouraged to do that. these are, I think, all part and parcel of the initiatives that we're going to be launching and have launched over the last number of weeks and months.
Okay. Well, why didn't we do it sooner, though?
Well, we didn't have a shortage of people. We are going to. We want to encourage more people to come, and we're striking while the iron's hot. You don't advertise for the sale of a project of a product 6 months before you need to sell it.
Our final reporter this morning, Mr. Premier, from CHVN, Taylor.
Hi there. How has vaccine shaming affected uptake? You know, we've seen in some cases these kinds of comments, which some has been made in press conferences, is fueling that refusal to get a vaccine.
Taylor, I missed the first chunk of that, so do you mind repeating your question, please?
How has vaccine shaming affected uptake?
You'd have to define vaccine shaming. I don't understand the term necessarily. Please do that.
Yeah, so we've heard things like more so the people who are in hospital beds are the ones who aren't vaccinated, even though we saw that people who are in hospital beds often got sick before they were eligible to get a vaccine or before they were even able to make it to their appointment, things like that.
Well, I can only tell you, Taylor, that we're trying to get the vaccine into more Manitobans, that there is every reason to believe that if we can get community groups involved in getting that word out, we're going to get more people involved in the vaccine campaign and get them safe. And that's exactly what we're trying to do. There is an absolute reality here. Close to 90% of our folks who are hospitalized haven't been vaccinated. Or if they were vaccinated less than 2 weeks ago and still contracted COVID or a variant of COVID. So there's a real risk in not being vaccinated. And when I reference that fact, that's not for shame, that's for fact. We need to understand that the vaccines work. We need to understand that people need to get vaccinated to be safe. Not perfect. They're not perfect. We understand over 90% effective though. And so it's really important that people get those vaccines.
And in the reopening plans, is there going to be different plans for geographic areas that have reached that vaccine uptake rate and those who haven't?
Yeah, this will be government employees that will be charged with the responsibility of evaluating applications. We hope we have many. We are reaching out to community groups and encouraging them to respond. They'll evaluate based on the effectiveness and the potential for effectiveness to move our number up. And so I can't, it's not going to be a political decision, and nor has it been throughout the time of our government when we have issued hundreds of thousands of grants, for example, to small business. It wasn't a political decision. On our cultural stay-at-home program, we had thousands, tens of thousands of Manitobans benefit from that program. These aren't political decisions, and I emphasize that because I think for many Manitobans, they'd be more inclined to get a vaccine if they heard it from a community member than they heard it from the government. It's a reality. Say thanks to everybody. Ask you to be careful out there. It's going to be a hot one, and it's going to be a hot one for the Montreal Canadiens next time they play. Premier Legault has agreed to a friendly wager, and he's agreed that he's going to be wearing the Winnipeg Jets jersey when we beat the Habs in this series. And I've agreed, though I won't have to wear the Montreal Canadiens jersey if we're not successful. However, just as we're going to fight from behind with COVID and be successful, so too the Winnipeg Jets will fight from behind and beat the Habs. Thanks, everybody.